My name is Dr. Thomas Schuler. I'm chairman of the Medical and Scientific Board of the National Spine Health Foundation.
Hi, I'm Tao Allen. I'm a fellowship-trained physician assistant.
Let's talk about some basic anatomy first so we know what we're talking about. First of all, the neck is the cervical spine. The neck is this area right below your head, above your rib cage. And that is when people have neck pain, it's somewhere there. But I'm going to pull our friend in here. This is a model of a skeleton that we can see. And the neck is this part right here, as we said, between the head and the rib cage. And that's called the cervical spine. And there are 7 vertebrae, those are the bones at each level. 7 vertebrae make up the cervical spine. This area down here is our thoracic spine, and this is the low back or lumbar spine. And it's important that this is something very personal to me. I'm a spine surgeon, and many people say, oh, he's a back doctor. Well, you have to understand, I treat the entire spine as a spine surgeon, as a back doctor. Half the stuff I treat is in the neck, half the stuff I treat is in the low back, a little bit in between, but it's 100% total. But I would say the majority of stuff that we treat is in the neck and in the low back. So in the cervical spine and the lumbar spine. So as a spine specialist, we're trained in all these areas and do manage all of them. This is a model of the neck. This is kind of just a section that we were looking at over there. So here's the base of the skull, and then we can see the 7 cervical vertebrae coming down. And so when people have neck pain, the question is it a muscle issue? Is it coming from their shoulder and creating a problem? Or is it coming out of the neck? And just like the low back, the neck has these 3 joint complexes between the bone above, the bone below, the disc, and then the 2 facet joints in the back, where the facet joints allow for motion and movement. So you have to keep the 2 facet joints healthy, keep the disc healthy, and keep all that moving. And if one of those areas break down, then that can lead to neck pain. Tao, when people come into you and present to you with neck pain, what do you look for? What do you see in them, and how do you treat it?
So I'm going to look for where is the source of the symptoms, right? Through a good physical examination, through the right imaging studies, whether that be X-ray or an MRI, to understand, is there a degenerative disc, a disc herniation, or a pinched nerve that's causing these symptoms? And after identifying where the problem is, then the most important part is then, of course, the treatment. And that could be quality physical therapy, the right type of medications, prescription or over the counter, to help treat the source of the symptoms. And hopefully that's what is needed to help address the symptoms. But the key part of to help address a lot of this is going to be the physical therapy.
I mean, fortunately, most people will get better non-operatively. So with the right rehab program, using a medication. But as Tal said, it's understanding where the problem's coming from. And that's what we as specialists do, is to identify the source of the problem, because then we can come up with the best treatment options. And no 2 patients are the same. They're all a little bit different. There's a little different understanding of what their mechanics are, what their job requirements are, their life requirements, what their motion is, how big they are, how conditioned or deconditioned they are, and then what actual degenerative changes may have occurred that need to be treated. So it's putting all this together to come up with the right treatment. But fortunately, again, more than 90% get better non-operatively. And for the ones that need surgery or need some other intervention, that's the beauty of this modern era, is that we have these incredible treatments that are available using artificial discs or fusion technology or a combination, aside from injections or other treatments. But really, it's so interesting to see, with the motion preserving devices, the artificial disc, how this is changing the future of patients' lives. Yeah, fortunately, no. And there's a lot of clicking and popping, and it's usually those facet joints that are in the back of the neck. They get stuck, and when people get them moving, it pops, and then they feel better. In fact, if you go get a massage, sometimes the masseuse will be pressing on areas of the spine. You'll feel a little click, and it helps relieve pain. That's what good therapists do, chiropractors do, where they get these joints moving. And so keeping that motion, again, it's an ever critical thing that you have to keep moving. But sometimes you can mobilize it, and sometimes you need help to get it done. But the clicking and snapping, if it's not painful, is not an issue.
A stiff neck in the spine is not an indicator of something bad that's going on in the spine. Typically, it's related to the arthritis or degenerative discs that can be causing the inflammation of the joints or of the muscle that's causing the stiffness. So it's not an indicator necessarily of something dangerous, but a sign that there's poor muscle imbalance. So that's why the physical therapy is super important, and deep tissue mobilization to help keep these joints moving so you function more normally. Because most of us are not symmetric in our motions, and that asymmetry causes discomfort and imbalance.
Yeah, I think that it just ever important to understand the anatomy so we know what's causing the problem. But when we look at the spine and I rotate it, we can see the spine moving, and it's again these facet joints in the back that have to move. And what happens when we sleep in a weird position or our neck's stuck and we wake up and go, oh, I can't move, it's usually because one of those joints binds up, and we have to get that released through time, rest, a warm shower, or some form of mobilization to help it. And sometimes just with a little time, maybe an anti-inflammatory, it'll settle down and then you get moving and then you feel better. But that stiff neck, it's not uncommon for somebody to get a crick in their neck, and then it's kind of stuck in a weird position just because they were sitting in a position. And it may go back to, hey, they hadn't been doing exercise and they were predisposed to it, or they just had some underlying degenerative changes that made them predisposed to it. But you can see, kids can wake up with their neck stiff, and so it's one of those things that happens, and by itself is not a problem as long as we can get it to resolve. So people often wonder about, okay, who should I see to get my neck pain treated, and where do I go? And when they come in and they see me, I'm a surgeon, they may be a little intimidated, but when they're seeing you, Tao, you're not threatening them as much just because your degrees aren't, I'm a surgeon. So when is it appropriate for a patient to see a spine specialist or a spine surgeon,
Sure,
as opposed to their family doc or somebody
Right.
else?
If you have an occurrence of neck pain, and you can usually, for the most part, with neck discomfort, you usually can overcome it with time, activity modification, over-the-counter medicines. But if it continues to persist no matter what, or the pain is so excruciating that the over-the-counter medicines or what you do at home doesn't seem to work, then it's time to seek help. Or if you have nerve symptoms or any symptoms of numbness, pain, weakness in the arms, that can be a sign that a nerve is being pinched in the neck. So that means that it's time to go see a spinal specialist, because you're going to need help and direction to understand where the problem is coming from and the treatment plan.
It's important to know that spinal surgeons don't operate on everybody. In fact, operate on less than 10% of the patients we see. And a competent spinal surgeon is somebody who will understand what needs to be done to get this treated, and either do it themselves or refer to a collaborative teammate who can help you overcome the problem. And it's important to understand that we only want to treat people with surgery, but that's the only way they're going to get better. And that way we can get great success. And reality is that most problems are solved without surgery, but it's a question of saying, are they doing the right thing? And that's what myself as a spinal specialist has to do with all my patients, to say, have we truly exhausted non-surgical ways to get you better? And so I'm happy to see people with acute neck pain, first-time issues, because I can help them get to a point where they're better and can avoid surgery. And maybe they need a long-term relationship because this problem may come back in 5, 10, 15 years. And so it's important to understand that we have a relationship, so if things get so bad, something needs to be done, we can address it. But fortunately, rarely do we need to do that.